I'd like to introduce the panelists. Beth Johnson, Director of Legal Services, is that right? Cabrini Green, Legal Aid. Kadeen Bennett, ACLU, Illinois. Reverend Al Sharp of Community Renewal, and Chris Lindsey of the Marijuana Policy Project. Chris is going to be talking about, they've released a report, and you have a one-pager on it, the executive summary. If you need another copy, we will be happy to email that to you. It's also available on the MPP website. Is that right, Chris?
That is, and I can have an address available when I'm doing my little song and dance.
Excellent. Well, with that, I'm going to hand this over to Beth Johnson.
Thank you.
Moderator extraordinaire.
I think Kathy wrote me into this, not because I didn't want to be here, I would have been here anyways in the audience, but Collateral Consequences is my song and dance. At Cabrini Green Legal Aid, what we do is help men and women that have been impacted by the criminal justice system. And we talk about collateral consequences. It's what happens not while you're in the system or before when you're arrested, but the lifelong effects that that will have on your living, on your places where you want to live, the education that you want to have. And so this panel is focused on the after effects. The first panel focusing on how we actually address the issue on the front end of the system. And this is how we address the back end of it and what happens after somebody is arrested, especially in this state where it is still a criminal offense in Illinois. We are not Colorado yet. So I'd like to start off with Chris, if you don't mind, because we do have your new report that's released. It's perfect timing. We were just talking outside with our potato situation, collateral sanctions, collateral consequences. If you want to, everyone has the executive summary, but talk about what we need to hear about your report.
Okay, so what the Marijuana Policy Project is, it's an organization, non-profit based out of Washington, D.C., and we do lobbying to change marijuana laws across the country, whether it's decriminalization, medical marijuana, and we were very much behind the program that's rolling out now in Illinois. And then last summer, we began a project to understand not only what collateral consequences are and how extensive they can be, but how they actually play out in Illinois. And so with the introduction of several bills in our legislature here in the state, it was a good opportunity for us to kind of revisit that research and put it together in a report for which now there's context and a solution. And so we are hoping to see Representative Cassidy's bill kind of carry the day because we think it hits all the right notes. So what we're doing is releasing a report. It's now available on our website. It's specific to Illinois. And it's available at mpp.org and then /IL marked for life, all one word. And that's really just at our main site. So what it does is it just goes through the universe of collateral consequences. These are the things that aren't necessarily part of a sentence. And it's a little deceptive because you'll hear law enforcement try to minimize how a person's life can be affected with a possession charge, and they'll say, well, you know, you might get arrested, but maybe not. You might go to jail, but probably not. You've got a nominal fine. You might have to go to treatment. No big deal. But as a matter of fact, once you have a criminal record and one that relates specifically to substance, I guess abuse would be how the system would term that. That could follow a person through job applications, through Section 8 housing applications, through public assistance, can affect professional licenses. It goes on and on and on. And so what we want to see with decriminalization is not so much about let's get away from fines and the potential for jail time. Let's allow people to continue to be productive members of society for choosing a substance that's less harmful than alcohol. So that's kind of our approach, and we're hoping to see some bills pass that will help address a very serious situation in Illinois.
You know, one of the things over the years, it seems that almost every year in Illinois, at least in recent history, there have been proposals in Springfield and bills that have been written which are touted as decrim. In fact, they're just less crim than they were before, where they might be a petty offense, right? But that's still a criminal offense that shows up on a record. And Kadine's been working this year at the ACLU, one of our strongest advocates in Springfield for a multitude of issues, and especially on this year, is HB 5708. And it's the first time I've looked at one of these bills and said, that's right on, because that's what we're trying to do, is to not have the collateral consequences that will follow you. Employers don't differentiate between a Class A or B misdemeanor, right? They do differentiate between a record and no record. And so if you wouldn't mind just going over the what 5708 is and why it's more than past efforts at this.
Great. Hi everyone, how are you? Awesome, no coffee and you're still good. Awesome. So as Beth said, my name is Kadeen Bennett. I'm a lawyer and lobbyist with the ACLU of Illinois, and I want to thank Beth and Al and Chris and Kathy because they're part of the reason that we're at the place where we have a bill that is not a criminal offense. So in Springfield right now, we have 3 bills that are considered to be decrim bills. One is sponsored by Kelly Cassidy. I'm partial to that one because that's the one we helped to create. The other is sponsored by Christian Mitchell, who is an African-American legislator from the Hyde Park area. And the other is sponsored by Representative Zalewski, who some of you may have heard his name because he was trying to get mandatory minimums for gun offenses passed in Illinois. His decrim bill came out of that desire to have mandatory minimums, and it was supposed to be part of a package. Now it's independent. So what House Bill 5708, Rep. Cassidy's bill, does, and I have to say, for dorky people like me who like to read legislation, there are copies in the front, so feel free to pick one up. It's really stimulating reading. So what we said is that for possession of marijuana under 30 grams, it would be considered a regulatory offense. A regulatory offense would be a non-criminal offense, and that's really different from the other 2 bills where they're petty offenses. That means that it's not considered a criminal offense. There would be a $100 fine for each instance of possession. So if you're caught with under 30 grams, you would get a ticket. That ticket would cost $100. If you pay the ticket, so the officer sees you, they find your pot, they ask for an ID. If you have an ID, you show it to the officer. If you don't have the ID, you give your correct name and address, and the officer is supposed to give you a ticket. Once you pay that ticket, then that record would be sealed. So the record goes away. If you don't pay the ticket, or if the officer believes that you've given the wrong name and address, then you could be arrested. We understand that that's not the best case scenario, that there are situations where you might be giving the right name or address and an officer can use discretion, but it's not the ideal for us at the ACLU. The ideal is for us legalization, taxation, and regulation, but this is an interim step. So the bill also creates a ticketing system, a uniform cannabis ticketing system, which we currently don't have in Illinois. There is over 70 localities that have a version of it, but this would be a statewide system. And one of the things that we made sure to include in this bill is that it won't affect someone's probation or parole status. So the fact that you got this ticket, you paid the ticket, that won't trigger that you would have to, that won't trigger a violation of your probation or parole. And so with Cassidy's bill, $100 fine each time, unlimited. So even if you had under 30 grams 50 times, you would still get a ticket. With the Mitchell bill, between 0 and 2.5 grams, that would be considered a petty offense with a $100 fine. Between 2.5 to 10 grams would also be a petty offense with a $100 fine. Once you get between 10 and 30 grams, then the first offense would be a petty offense ticket, and then after that it would be a Class A misdemeanor. So unlike our bill where it's always a ticket, at some point it triggers a misdemeanor with the Mitchell bill. With the Cook County bill, the Zalewski bill, the first offense is a petty offense with a $250 fine. The second offense would be a $300 fine, petty offense, and subsequent offenses would be a Class A misdemeanor. We think our bill is better in terms of the fine amount, the fact that you have unlimited tickets, and I think that it's the only bill that does the sealing of the records, which we think is really, really critical. I'd be glad to answer more questions about the bill, but that's the general lay of the line of what the bill does. I have to say, it's really good that we have these three bills. It's unclear which of those bills, or if any of them, will get out this session. We have until next week to pass a bill out of the House, which is where those bills are right now. But next week there is going to be a discussion to figure out which of these bills we're going to move with. All of the sponsors they're committed to one bill going out, and I think we're pushing for the best bill possible. And not to be biased, but we think that our bill is the best bill because the impact it would have on collateral consequences. Sealing of these tickets would be a pretty critical step. We know that Mitchell is open to it, Zalewski is open to it, but I think if you all live in their districts, or if you all care about this issue, calling them and letting them know that 5708 is the path that you think is the best path would be a good idea to do.
And Chris, you've done a survey of all these states, so there are different degrees of what states are doing in terms of this. And where is Illinois falling on that? In terms of, we have 3 different bills here. Do states have 3 different schemes like that in their own, in terms of how they treat these as criminal offenses or not?
Well, it is a mixed bag, and decriminalization has actually been around for quite a long time. Depending on how you define decriminalization,
Right. The definition of it seems to be important.
Right, and it is confusing. We have Washington and Colorado that have now implemented tax and regulate systems. So is that decriminalization? You know, and if you say yes, then there's 16 states that have. They have laws such that you do not come away with a criminal penalty, and that's really the bottom line. And that's why I would say that Representative Cassidy's bill is the only decrim bill we have. It's nice to lower penalties, right? It's anything to move the ball, but if you mean to allow people to be free from the stigma, to not be dragged down by choices that often they made in their youth, most of the people who statistically get in trouble for possession tend to be between 19 and 25 years old, and so these are decisions that can be made early. Your penalties are long behind you, and you still pay for the rest of your lifetime for having this criminal record. And a good example of that is a person that I got to know recently named Whitney Shurinsky. And Whitney got in trouble when he was 16 for possession of less than 2.5 grams of marijuana. And if you know your marijuana weights, that's not much. That's about a joint. And probably a little bit less. He, 13 years later, was applying for Section 8 housing in Clark County, which is a pretty low population county in central Illinois, and was turned down because of that record. And so his choices are few in a county with not a lot of options for housing. That was 13 years after the fact. So we think that's pretty serious, and that's why we're very much focused on Cassidy's bill.
Reverend, I've had the pleasure of working with Reverend Sharp for a number of years, or at least watching him from the sidelines, and one of the greatest feats that they've had in the Illinois legislature was just last year with was 2 years ago, last year.
Yeah, it was last year.
Last year, medical
Absolutely.
marijuana. It was,
Last May.
and it took quite a while to get there.
Absolutely.
And so if you wouldn't mind just explaining what our state does have on the books now, officially where we're at in the process, and how you're able to get there after a long, long battle.
Yeah, we have a bill that legalizes cannabis for medicinal purposes, medical marijuana, if you will. I think at the time we passed it, we were the 20th state, which means that 40% of the population in this country now lives in a state where cannabis as medicine is legal, which I think is changing the debate about drug policy much more broadly. It was one of the major reasons that I chose to get involved with it, to have that broader impact. But I will say that I got to know patients who suffer from chronic acute pain, and you can't work with folks who are in that horrible situation without saying, this is really what I care about most of all, and that's what impelled us to work so hard on that bill. Even if we'd done nothing else, everything we did would have been worth it. It's a very tightly regulated bill. It specifies 40 ailments, cancer, Crohn's disease, ALS, multiple sclerosis, very specific ailments, many of them really quite terrible. No chronic pain provision. In other words, if you have a sore knee, you can't go in and get a prescription from your doctor. But 40 specified medical conditions. The patient has to obtain a letter from his physician sent to the Department of Public Health that stipulates, specifies, makes clear that there is a doctor-patient relationship. The doctor has to write that. He or she, the patient, has to get an ID card. I think they have to be fingerprinted, which is pretty odious within all this. But the fact is that they can then move forward. They have to get their cannabis from a dispensary. The amount is regulated. One thing that we had to do to get the bill passed was to take out what was called a grow your own provision. There was initially a provision which said that patients could indeed cultivate their own cannabis or receive cannabis from a caregiver who was allowed to grow, and that was taken out of the bill. So it's a very tightly regulated bill. Some would say too tightly, but the fact is it's on the books, and I was willing to make those concessions, not that they were mine to make, but I was willing to support them because I thought once this is out there and the effect is demonstrated and the importance is demonstrated, then the better things will happen, and I think that will prove to be the case. Furthermore, it's a pilot program for 3 years, and that was another selling point in order to get it through the legislation, but I like to think about it as comparable to Obamacare. You get it on the books, you have people benefiting from it, it won't be taken away. How did it happen? It took a long time. I've worked on it for 3 years. This was a collaborative effort. Nothing like this is done through the efforts of one or even a few people. The marijuana policy staff was just terrific, and they knew more about the Illinois legislature than I did, and they're not even on the scene. We had 2 folks working full-time in Springfield as professional lobbyists. My role was what I call retail politics. I spent a lot of time meeting patients, taking them to local legislative offices, and simply having them tell their stories. And I think, from my perspective, that's probably the single most important reason that it passed. There were people, we needed 7 votes. It took 3 years to get them, and it happened because legislators who didn't start out favorably inclined said, my gosh, you know, I've got a family member who might have benefited from this. I have a dear friend who might have benefited from this. I remember Senator Kwame Raoul with tears in his eyes as the vote came in the Senate saying, my father in the last days of his life suffering from cancer would have had much less pain in his life. He said, my father would not have done this. My father was a conservative man, but his last days would have been much more bearable, and I'm going to support this bill. So that's basically how it happened. Do I have a little more time?
Yeah.
Am I saying too
Give
much?
all the time you want,
Okay,
Reverend.
well, I'm rambling on here, but I'd
Well,
like to
in limitation.
I'd like to relate what I experienced in the medical cannabis bill to the decrim bill that is now pending in the Illinois House. I went out to a legislator from Wheaton, Illinois, very conservative evangelical Christian, and I argued for the medical marijuana bill, and he was really dismissive. It was infuriating. He said, those stories you tell about patients are just anecdotes. Can you imagine? They're just anecdotes. And I said, how can you say that? How can you be against this bill? And he said, because the law is a good teacher. This was a moralistic argument that I'd never heard put quite that way. He was saying that the law and something like the use of cannabis is a means of instructing people on what arguably could be called matters of personal morality. I'm not going to put that heavy weight on the use of cannabis, but from his perspective, that's how he was saying the law ought to be used. And I was stunned. I didn't have a simple comeback. I just had never expected this. I went back to my office where I have a dear colleague, Walter Boyd, who has worked in this field for a long time. His own personal story is quite remarkable. And he said, yes, Al, but the law is not the gospel. The law is not the gospel, and I began to think about that. I think the real faith-based message, the message to clergy and others who care about the faith-based aspect of all this work, what I think is distinctive to be said is that we are a culture of punishment. We use laws in this country in a way that is simply wrong. And what is important about this decrim bill is that it acknowledges that. And it says that the laws should not be used to to legislate matters of personal morality, except in the rarest of circumstances. And I think that's the argument that is coming forward that, from my point of view, undergirds the importance of decriminalization and ultimately legalization. My board, the organization I headed for 15 years, Protestants for the Common Good, went crazy trying to understand, and I couldn't explain it very well 8 years ago, the difference between legalization and decriminalization. Well, the fact is decriminalization takes an offense out of the, it takes a particular action out of the criminal justice system and makes it like a traffic ticket. If I'm speeding, I don't resent getting a traffic ticket in the same way that I think I would be burdened if I were put in the criminal justice system in the way that the law now punishes drug offenses. The distinction is a very important one, and I think from a faith-based point of view, the ultimate importance is that you should not use the law in ways that we use it in a very perverse and un-Christian way. If I can speak of my own faith, Jesus, when he saw the woman caught in adultery, didn't say to her after the elders had been humiliated, he didn't say to her, now get down to the local sheriff's office and make sure you're properly booked. He said, go and sin no more. That's what our faith is about. Our faith is about compassion and treatment. And that's what our emphasis should be, and that's why this law is such an important one.
And what are, Chris, if you could talk about the opposition and how to overcome that, because there's opposition everywhere you go, because if there wasn't, we would just have this on the books everywhere. So people can understand the difficulties in passing this, because like-minded people might think this is a good step forward. It doesn't make sense to clog our criminal justice system. We're talking about marijuana. As you started off saying, it's less harmful than even alcohol. So if you could just walk people through the obstacles you face and how to be an advocate against those.
Well, it's a good question, and the way that I think the Marijuana Policy Project approaches it is to always generate as much public discussion as possible. And so if you see how we work from one state to the next, there's always kind of this grand plan to generate public discussion, because it's when you shine a light on what's actually happening that we win. It's when you take opposition arguments at face value, that's when the opponents win. And so, for instance, you will hear law enforcement and those who represent law enforcement interests say, well, if we were to decriminalize marijuana in Illinois, teen use will go up, we will have more people consuming, the sky will fall, cats and dogs will sleep together. And the reality is that we've had decriminalization in America for decades, and there's no empirical evidence that consumption has gone up, that crime has gone up, none. You hear this in every single context. Teen use will go up. Where has it gone up? In fact, there's evidence that the contrary is true, that it's actually gone down slightly in most of the states that have medical marijuana, in most of the states that have decriminalized. Now, it's a bit of a red herring argument, because teen use waxes and wanes over the years, and it does not seem to be very closely related to changes in the law. But if you allow the opposition to make broad, scary-sounding statements that are sweeping and breathtaking, and are sure to scare a certain segment of the population, but you allow those statements to go unchecked, that's the vacuum that we can't allow to exist. And so what's exciting is in states like Washington and Colorado, in the decrim states and the medical marijuana states, we now have a track record that we can point to say, where is it? How about the gateway theory? Okay, we all are familiar with that, right? If marijuana is made more readily available, cocaine use and heroin use and all these awful things are going to happen to our society. Well, guess what? We've had medical marijuana available in Colorado in an almost entirely unregulated medical marijuana system since 1996. Where are the heroin addicts? Where are the cocaine users that were supposed to come from this horrific situation in California? It never has materialized. And yet the opposition will still persist in these arguments. And so it's up to advocates to hold their feet to the fire. And so that's why Marijuana Policy Project does what we do. We write a lot of papers, we talk to a lot of elected officials, we'll put billboards up to generate discussion. And one of our common themes now is, let's not punish people for choosing an option that's safer than alcohol. And you know, I'm actually, because of my own history as a medical marijuana provider in Montana, I'm on federal probation. And the irony is that all you folks that pay taxes contribute to a urinalysis test that I take about every 4 weeks. So thank you for your contribution. But ironically, I can drink all the alcohol I want. How does that make sense? So anyway, I'm kind of on a tangent.
And Kadeen, if you want to talk, especially hear what's going on right now with what you're experiencing.
So so the fact that there have been these 3 bills out there, we've had different approaches to the bill. So for Cassidy's bill, one of the things we keep hearing is that we're offering too many chances. The fact that our tickets are unlimited, we have folks who are like, that's going a bit too far. You know, we can understand giving them a warning, a ticket the first couple of times, but if you're doing it unlimited, then you're just saying that it's okay. We've heard that the amount, so under 30 grams would be ticketable. We've heard that that amount is too high, that, you know, that's just tons and tons of pot, and that we really need to reduce it to 2.5 grams, even though there are other states who have that. 30 grams is almost, it's a little bit over 1 ounce, and other states have that number. We've heard, because it's a political season, there's no way I can vote for this in an election year. You know, I understand, I get what you're saying, but, you know, it's too close to November, we can't vote for it. We've also heard that it's too soon after medical marijuana passed. The fact that we have medical marijuana, it's a pilot program, that if you did decrim, you're gonna do something to end up in a scenario where we don't get medical marijuana permanently. But it's been interesting because there are some legislators who understand why this bill is really critical. They know from their communities who are the folks who are mostly stopped and frisked, who end up getting arrested, who would be, and this would actually be a good thing for them. And I think there are some legislators who we're seeing who are more of the conservative bent, who are saying this is good because it means that law enforcement will have time to actually like take care of real crime. And they don't see this as a real crime. And it's been really surprising to get support from folks that we never thought possible, because they do see this as a non-issue, that there shouldn't be so many people who in any way end up in jail, or even with a record because they, you know, were caught with small amounts of drugs on them.
And Reverend, do you have
I'd
anything?
like to talk about the report in one particular way and to compliment it, praise it, if you will, because I think we knew that there were collateral consequences. You know that if you're arrested for pot possession, your life's going to be a heck of a lot harder. What this report does is bring forward in one place the full extent to which that's true. There's not a lot of new information here, although there's some good documentation about Illinois law, but it simply says in one place, powerfully, you're going to be hurt if you're looking for employment. You're going to be hurt if you're trying to subsist, if you're trying to get food, if you're trying to get housing. You're going to be hurt if you're trying to get an education. Federal grants can be cut off. It puts in one place the full range of the collateral impact that we need to know about, and that I think makes this report especially powerful. I'd like to offer a challenge. When you're talking about the different subject, when you're talking about the opposition to this bill, when I think back to medical marijuana, the two sources of opposition that were hardest to deal with were law enforcement. And you're not really going to change law enforcement very much. They've been trained like bloodhounds to do a certain thing over their entire life. Actually, ask them to turn on a dime is very, very difficult. They've been trained in enforcement and repression, really, when it comes to enforcing drug policy. The second source of opposition was the group that were worried about marijuana as a gateway drug. I found that argument very hard to refute. My guess is, and I'm not an expert on the research, that you can probably find research in either direction to say yes it is and no it isn't. I don't believe it is. The worst case is, well, but what I believe, but I find very hard to say succinctly. And my challenge to you is, if you can think of a way to say this succinctly, please let me and others know afterwards. What I believe is that one goes back to the phrase that President Obama has made so well known, if you will. at some level, we all have a hole in our heart. There's something we're longing for. You reach out using methods of self-medication very often. But what one has to look at, if one's worried about the gateway effect, is not what comes in through that gateway. It's why the person has a hole in his or her heart. And so it's going to be something. If the hole is deep enough and causes enough pain, you're going to find something. Sometimes much more perverse products than marijuana. So the issue is not whether there's a gateway and whether it's a gateway drug, but the gateway in that person. And therefore, I think to say, gee, marijuana is a gateway drug is not really relevant. The draw is there, and one simply needs to acknowledge that and deal with the hole in a person's heart. How you say that in a few words, how you diffuse that very volatile argument, it's a gateway drug and we've got to continue to be repressive, I think it's very hard to do in a few words. And I'd welcome your suggestions on how we could do it better.
Oh, I can do one.
Okay, go for it.
If we're concerned about gateway drugs, why is alcohol legal?
Okay.
Right. I mean, the reality is it a very, very small
But
percentage.
the rebuttal, Chris, the rebuttal you'll get for that is, okay, the fact that we have one drug legal doesn't mean we need another one.
Right, but that doesn't.
I'm with you, but
that
that's the
doesn't
argument you'll
that
get.
doesn't undermine the fact that if you're concerned about there being a gateway.
Yeah.
Okay, and there, you might hear the argument that, well, alcohol's been part of our culture. Well, so is marijuana. It's just simply underground.
Yep.
If you look at what's happening in Colorado, usage rates actually aren't changing now that it's available in a regulated environment. What's happened is usage has shifted from the underground market to the regulated market.
I do think too, I remember last year I called the opposition and advocacy for medical marijuana in Illinois the tale of two baggies, freezer-sized Ziploc baggies. So there's one on the floor of the House during the debate when I forgot what legislator it was. It might have been Representative Seisha at the time.
Oh, yeah.
Holding
Oh, my
it
God.
up saying, this is how much we're going to let people have at one time.
Yeah.
And then you counter that, the tale of the two baggies is a patient or someone that's suffering saying, this is how many prescription medications I have to take.
Oh, yeah.
Right?
Mike
So
Graham, yeah.
competing those freezer-sized baggies
Yeah.
about the issue at hand.
Yeah. Yeah, absolutely.
Okay, did we want to take questions now?
No,
Oh,
I know this is kind of an interesting issue, and since it is moving rather quickly through the General Assembly, I did want to be able to offer people the chance to spend a little bit of the time now that they have an outline of sort of what's going on and what the issues are to ask questions of our panelists. So do folks have questions? I know last time we had a little bit more organized, we had index cards, and you probably just got a piece of paper.
you ran
but,
out of them like the coffee, Kathy.
You know what? I'm just falling apart here. What can I say? No coffee, no index cards. Whose hand went up first? I'm going to give it to you.
Okay, Dr. David Ostro, Vice President of the American Academy of Cannabinoid Medicine, and we just merged with the Scientific Study of Clinical Cannabis Group out of San Francisco. It distresses me that Chicago's law, including several others, starts out by saying no psychiatric conditions, and then many people erroneously believe that PTSD or PTSS, whoever you want to call it, is a purely psychiatric condition. And I'm told by the people who are leading the fight to get that changed, that's going to be a long and uphill slog. And I wonder if any of you know why that is. Is there a particular, or was there a particular anti-psychiatric use of medical cannabis represented on by the people who wrote these rules? Or what are the specific problems there? Because it's a huge number of people who are already self-medicating with this drug, and we as researchers would like to be able to legally conduct trials to figure out the appropriate treatment with cannabis.
Right. Well, there's quite a bit going on with PTSD right now. So I'll start with what I know that happened in Illinois, and then we'll talk a little bit nationally, which you probably know as much as I do, if not more. So I think if Representative Lang were here, he would say that the bill that he got was the one that he could get through, and by the skin of its teeth, because it was down to a single vote in the House. That's the
Who
easy
was that
answer.
last vote, by the way?
And I don't know, I'm sorry.
We did get
Reverend?
up to 64, but it was very, very, we didn't know when the bill was called whether we'd get over the top.
Okay.
Right, so, and that's always the answer that you'll get. Now, insofar as why isn't PTSD always in the bill? Every single law across the country, you'll see Crohn's disease. You know, where did that come from? Where PTSD does seem to resonate is when you have a regulatory agency that is able to hear petitions, do its own analysis, and then add those conditions. And so we've seen that happen most recently in Michigan, and then also in Nevada, where the regulatory agencies themselves have done their own analysis. We had a bill going through in Arizona, which was the first bill in which the federal government, through the DEA and another organization called the NIDA, were willing to allow scientific study on marijuana, the plant, the entire plant, and how it would positively affect individuals with PTSD. That was the first time that had ever happened, because the NIDA's mission is to do nothing but support science to show the harms of marijuana. So one of the reasons why marijuana is scheduled as a Schedule I drug, and DEA loves to say there's no studies that show that it benefits people medically, is because the NIDA will not make marijuana available for any studies. So, I'm sorry? Right.
That are, like in the case of the University of Michigan, to create a medical cannabis program that says it's to give cannabis to people who need it, but its real goal is to read the grant, is to look at the long-term negative.
Right, and that's all, that's the running theme anytime NIDA is available. And so it was front page news that they were funding this Arizona study, which was specifically to find its benefits. So I don't know the behind the scenes story. Unfortunately, the bill got killed because while it sailed through the House, it got into the Senate, and the chairperson on the Senate committee sat on the bill, refused to allow it to be heard, and then the clock ran out. So for some reason, we got clearance from the federal government, and it was the state elected official that put the brakes on it. So that was just a real shocker. Now, getting to your question about psychological, and I'm familiar with this question about whether or not it's psychological or physiological, and I appreciate that. But generally speaking, I think legislators are a little hesitant to leap towards what many would consider a psychological condition, and they tend to focus on the physical. Whether that's right or wrong, and I think it's wrong, but that's the way it is.
Well, if you come from the psychosomatic illness perspective, it's wrong.
Yeah, and THC does well with psychological issues.
Okay, moving on to a real sort of basic and sometimes controversial question. When you say marijuana is less harmful than alcohol, what is the metric? Physical effects, behavior of the intoxicated, or something else?
Well, who said it so they can answer?
I say it all day long.
Yeah.
So Chris Lindsey, let's hear your answer.
Well, alcohol can cause cirrhosis of the liver. You can overdose. Tens of thousands of people do every year. There are emergency room visits. It leads to violence. It leads to loss of jobs. It leads to obesity. It causes untold damage in our society. Marijuana has yet to lead to the death of a person because of its consumption. And I would challenge anybody. In fact, we got fact-checked on that when the Marijuana Policy Project came out and loudly proclaimed that marijuana is safer than alcohol. PolitiFact checked us on it and validated it. And now even President Obama has acknowledged that it's less harmful than alcohol.
This is a question for Kadeen. You mentioned that one bill needs to come out of the House in the next week. Can you explain why and how the lunatics of Springfield actually work? Since it's clear.
The lunatics of Springfield.
So,
Yeah.
theoretically, we could have multiple bills, multiple decrim bills. Can folks hear me? Okay, we could have multiple decrim bills come out of the House and go to the Senate. All three sponsors made the agreement to work together so that one bill would advance, because you had legislators who said, I don't want to vote for this multiple times, just figure it out and then put it on the floor and then we'll vote for it. I think, you know, our representative Cassidy wants to be the person to move the bill because she thinks she has the best bill, and we agree with her. And we think it's possible to get the best of all of the other bills. So for example, I think one of the bills deals with plants, and we would be okay with including that. I think, so at some point there's going to be a meeting where three of the sponsors are in a room together with a couple of other folks who've done work on the drafting of the bill and come to an agreement. I think some of the things that will be considered are the amount, so 30 grams. All of the bills currently have 30 grams, but we also get into how many votes do we need to pass the bill? We need 60. Can we get 60 votes with 30 grams? What's the minimum that we're willing to move down between 30 and I know folks aren't really agreeable to 2.5. That was a suggestion. I think that's not where we're coming from at all. I think the other thing that's really important for us is to push to make sure that it is a stealable offense and it's not a criminal offense. The regulatory scheme that we set out, we think, is really critical, because it could be helpful without it, but it's not as helpful without it. And we want to make sure that we move the best bill possible. I think the thing that's difficult is that if we were to, at some point, we're not the only bill in town. So if at some point we were to say, you know, the environment's not right for this right now, let's hold off for a session and see where things are, let's wait until after the election, there are two other bills that can move, and there are two other bills that aren't as good or as helpful as ours. So there might be a need for compromise. We don't know exactly what that would look like yet, but I do know that we're really committed to having the regulatory scheme. We're really committed to making sure the fine, I mean, I just think about people who would have to pay a $250 fine. For a lot of folks, that's really not feasible for them. So then they end up being arrested, and that's not the point of this bill. It's interesting to note that DC recently passed, Washington recently passed their own decrim bill, and their fine amount was $25. And think about that. Think about how much more doable $25 is versus $250 versus even our fine of $100. And I think we're trying to balance what's possible in the General Assembly and what's doable, and then what are the bottom lines that we need to have in order for this to be a successful bill.
And a follow-up on that, are the clerks objecting to 5708 right now?
Is there a clerk in the room? Is there? Yeah, they're objecting to it. So what our bill says is if I go to a courthouse with my ticket and my payment, then I go see a judge, then like kind of when you go to traffic court to pay a ticket, then the judge would order that the record be sealed. If I don't go before a judge, or if it's a situation where I pay the ticket by mail, then we're requiring the clerks to seal it automatically. And the clerks are saying, you know, we don't want to be responsible for that. What if we don't seal it? We don't want to have that liability. And you know, their thought was, well, the person could just get it sealed themselves. But I don't know if any of you have ever tried to seal a conviction. It's a long process. It's a complicated process. We're actually trying to help people to make it easy as possible. So to require them to seal it themselves, we think it's a burden that, you know, we could figure out a way to work around it.
And plus, you can only seal criminal offenses by definition, and yours isn't, right? There we go.
Yeah, it violates the purpose of the bill. They
Right.
have to do it yourself.
Right. Is anyone familiar with what's going on in HB 4299 regarding cultivation and distribution on this panel here? Okay, we'll skip that question. And the last question regarding 5708, does it deal with employers and whether they're able to ask, have you ever been cited for possession of marijuana? Has that come up in any of the conversations?
It has not come up. I think an employer, you know, that would know this better than I would if they have the ability to ask. But for intents and purposes, we wanted to have a bill where if an employer did a background check, there wouldn't be any kind of record. I think there is a question about whether or not somebody would have to, well, if they've asked, have you been convicted of a crime? This is a non-criminal offense. It's a regulatory offense. So one could say that, no, I've not been convicted of a crime because it's a regulatory offense. That's why we, and with the nudging of our coalition partners, really try to get off that petty offense dime where it's not a misdemeanor, and that's good that it's not a misdemeanor, and to recognize that, but it still is considered a crime. So I think with a regulatory offense, unless your employer asks you straight out, have you been, ticketed for marijuana, then you wouldn't have to disclose.
Right. Chris, have you seen any other states deal with that in terms of employment applications and the unintended collateral consequences by not asking the traditional question, have you ever been convicted?
As far as I know, it's always about criminal convictions.
Right.
I mean, now in Illinois, it's this oddity where, for instance, the Public Housing Authority will ask if you've ever been arrested, and that just to me is shocking. Like, really? I thought we lived in a country where you're innocent until proven guilty, but
Except when it comes to subsidized housing.
yeah. So at any rate, I haven't seen that issue really come up in any other context.
May I interject?
Yep.
I just want to say that, that the regulatory offense took quite a bit of work, right? I mean, this was not a simple fix within the the code, because there's no way to put in a civil offense, and so it took a lot of maneuvering to create this, and so I really do hope next week when we come, whatever the decrim bill is, that the regulatory offense will stay in place, because part of what we don't want to move to is the idea that decriminalization has happened, but you're still being convicted of a crime, which isn't really decriminalization. It's an alternative penalty. So I just wanted to make that, and people who don't work on legislation, and this might be now getting boring for them, but I just want to say, like, it's very difficult to create a whole new part of the code.
Right, just for your law.
Yeah,
Right.
exactly, just for your law. Like, it doesn't exist, well, we'll just create that. I mean, imagine doing that.
Well, Kathy, how did it happen in the city of Chicago? I mean, I'm not a lawyer, so I marvel at all that's been done to fashion the regulatory offense, but what part of the law made it possible to make it a traffic ticket in Chicago or in other home rule municipalities where it has been so designated?
That's an ordinance violation, and the state law still applies. So you can use, the police have the power to use either the civil penalty under the ordinance,
Yep.
the city ordinance, and that's usually adjudicated through administrative hearing courts.
But if you know how Chicago works, if the mayor has control of the city council, he says, I think this should happen, and the city council votes for it. And that's exactly what happened.
Is McDumpke here? He left. Oh, too bad. I'm sure he'd have some real good insights on that. Anyway, and in fact, we're going to be releasing a paper on evaluation of ordinance violations on the 30th of this month. So you'll be able to see actually what that looks like.
So right now, municipalities can opt out of the state law, for lack of better terms, by creating their own ordinance that doesn't make it a criminal penalty. Are municipalities going to be able to do the opposite then?
No, that's where preemption
Okay.
comes in. So you can't, if state law, so if your state law is here and your ordinance is here, you can go there. But if state law is here, you can't go above that. If that makes any sense.
So just to clarify, if the state law is put into effect, if we do get decriminalization, then you cannot, there's no arrest. Because you can't, I'm just trying to...
You couldn't have an ordinance that says, oh yeah, in our town you sure can be arrested. You
Right.
can't it creates a ceiling.
Right.
Right, and so in Illinois we've got a patchwork system right now. We've got law enforcement with a great deal of latitude.
Don't give away our findings.
And I won't. But I will say one thing that the ACLU did identify last year, and that's in Illinois, African Americans are 7.6 times more likely to be arrested for marijuana possession than their white counterparts, and that's with similar rates of use. And so this arbitrariness that happens where law enforcement can sort of make the call has profound effects on minorities, profound. And yeah.
I'm going to ask one question, and I don't think that most people conceptualize drug policy change or reform this way, but it's one thing that I do, and I've started to come to this with marijuana as well, is Is drug policy reform a human rights issue? That's for the panel.
Absolutely it is.
I mean, what makes it a human rights issue? What makes it a human rights issue? What about this issue makes it a human rights issue? And why do we have Reverend Sharp up here talking about this? And maybe you can,
I can give you 3 reasons why I'd be talking about it, and it wouldn't necessarily be because it's a human rights issue. So I'll let others speak to the human rights part of it. For me, it's an issue of fairness, justice. The statistic just mentioned is a huge injustice. The fact that people can't flourish in this world as we all intend and hope for is for me, a violation of my faith. And then the whole notion that in this society you don't have a second chance once you're convicted of even the most minor drug offense is an offense to my sense of what this world should be about and what meaning really is. Whether that then translates into a human rights violation, I'm not as sure about, because for me, human rights talks about what one is intrinsically as a matter of race, age, gender, and I'm not sure how one makes that match here, but I'd sure love to hear the argument.
And I would make a libertarian argument that Penn Jillette said recently, if I can't put what I want in my body, then I don't live in a free country.
I want to respond.
wait. I would like to hear from the panelists first.
Yeah, so I do think that you can make the connection to human rights when you think about the right to economic, there's an economic right, a cultural right, a social right, a civil right. I think all of those things are implicated when you think about the disparity in terms, exactly what you were talking about, the disparity in terms of who tends to be stopped and frisked, who is more likely to be found with something on them, who's more likely to be let go with a warning versus who isn't. I think about, I went to college at Wesleyan University in Middletown, Connecticut, and it's a pretty liberal arts school. And I think about the fact that our school sponsored, we had a dorm, and every Wednesday you knew that you can go smoke weed in that dorm. And it was something our school administrators knew about. It was something that alumni supported. That was free. You were free to do it wherever and whenever you wanted to. But if you went to Middletown, which is the town that our school was in, and you found black or brown people who were smoking weed in their house, they would not be treated in the same way. It wouldn't be, oh, you're just kids just trying to figure stuff out. So I do think that there are some human rights that, I don't think you have a human right to drugs. I don't think you have a human right to, but I do think you have a right to have economic security. And I think sometimes that's lost when, because of a choice that you've made, you're being penalized, and that penalty goes beyond, even if you're arrested and you did a year in prison, that follows you for the rest of your life. It affects where you're able to sleep, it affects where you're able to work, it affects the relationships around you. So I think that that's hugely problematic.
And getting the theory out of the human rights, at this time, just a practical aspect of it. We were at an intake meeting a couple of weeks ago, and we do criminal defense cases. So people will come to us and ask for us to represent them in criminal court. And this young man had been arrested for pot. He was standing on the street corner, and the police just came up to him, pulled up, and just searched him. Just searched him without any probable cause, right? And he did. He admittedly had weed on him. But the fact of the matter is that it is a norm, and it was something that happens all the time, to just have police come up and search your body because of the color of your skin and the neighborhood you're in. And one of the intake workers was like, well, he had weed. I don't think we should be able to take this case. So put that aside. But we equated it to, could you ever imagine someone, let's say a DePaul student in Lincoln Park, thinking that's okay to have the police come up on you and search your body just because they chose to do that? That's how we have to look at this issue, the actual practicalities of how people are treated because of the color of their skin, because of their economic status. And we can't ever forget that. Because I don't need a study to know that my white friends that smoke pot so much growing up, none of them have a criminal record. None of them, at all. And the report just validated what everyone else knows.
Yeah, I would agree with all that's been said, and I remember the point where I was talking with Walter Boyd about the notion that maybe we should add the notion of criminal records and how society treats that to the Illinois Human Rights Act on the basis that after 7 years, a person is, I think there is research that's shown, I can't cite the source, that says you are no more or less employable if you have a criminal record than if you did not. And if that's true, then it seems to me that it is a fundamental human right not to be discriminated against because you have a criminal record. So I agree with all what's been said here.
Can I add a historical note to this? It becomes a real human right if you look at the history of why cannabis was chosen as the poster boy for the war on drugs in 1937 and why it was put in Schedule 1. Because at the time, it was not a real drug problem, except among groups that they wanted to marginalize. Migrant workers coming from Mexico were smoking weed rather than tobacco during their breaks. Blacks moving north were accused in the Hearst papers, which were printed on yellow paper, and that's the origin of yellow journalism, of using a joint to make your white daughter into their possession that they could then rape and use on the street. Homosexuals or other perverts could expose a young man to 2 puffs on a cigarette, and they would turn them into homosexual, etc. So that was the types of attitudes that went into choosing marijuana, putting it in Schedule 1. And so from the very beginning, the treatment of cannabis has been extraordinary. There's no other Schedule 1 drug that carries the stigma and the difficulties of researching it and so forth. Even heroin and other drugs are freely available to qualified researchers to do research on the beneficial uses of them. It's only cannabis, and it all goes back to attitudes which are racist, homophobic, anti-others in our society. I think we have to call out the people who are against legalization of cannabis for these attitudes and
Let me make this a little more
and vote at the voting booth to get them out of.
Let me make this a little more complicated. I certainly don't think one should be discriminated against based on a criminal record after a period of time. And that's what I was referring to when I said presence of a criminal record ought to be added to the Illinois Human Rights Act as something against which one cannot be discriminated against. But let's look at what's happening with Amnesty International as we speak, where they want to decriminalize prostitution, sex trafficking. Let's put the sex trafficking, the coercion part out of it. They're being pilloried for doing that, for wanting to argue for decriminalization of prostitution. And are we contradicting ourselves when we argue that prohibition of drug use is wrong, but we can't take the same position when it comes to prostitution?
Okay. But I do have to say, maybe Iowa City was exempt from this not being able to research, because my friend got paid to go smoke weed at the University of Iowa hospitals as they watched her for 2 hours. I thought that was awesome. You get paid to go do that? So this is a question I wanted to ask. As a treatment provider, can I treat them instead of a fine? And so that kind of goes back to the first panel. We're talking a lot about treatment and whether people actually need treatment that are being arrested for marijuana. And this actually brings in the vision of Portugal, Reverend,
Yes.
what we were talking about earlier. So if you don't mind just sharing how they address that.
Yeah, thanks. This is what the vision should be for all of us. And I'm amazed at how few people know what has happened and is happening in Portugal. They've decriminalized not just marijuana, but all drugs. All drugs. They have a system, and I'll be very brief or try to be succinct about it. They have what are called dissuasion commissions. Dissuasion commission will consist of a social worker, a doctor, and a lawyer. Police are now under law, and they do this as a matter of routine, refer they refer drug offenders to dissuasion commissions. The commissions interviews them. This does not mean that, and interviews them. If it's a recreational use, again, no matter what the drug, basically the drug is decriminalized, as we're talking about now here at the state level. There may be a fine, there may be a community service requirement. That's 90% of the people that are referred. So that takes care of 90% of the population. The remaining 10% are judged to be serious addicts. It's a real health issue, and they are given the opportunity for treatment. They aren't required to show up for treatment, but in Portugal, treatment is available. That's 10% of the population, so all drugs are decriminalized. Drug trafficking, drug selling is illegal. But use up to a certain level, distinguishing you from a user rather than a trafficker, is decriminalized. And the bottom line is drug use is not increased. It's decreased in some age groups. And crime is not increased. And in fact is lower in Portugal on both counts than neighboring countries. That's the vision we should have for this country. And that I view House Bill 5708 as simply an incremental step towards that vision.
I think there are some states, yeah, I think there are some states where after your first offense, you can get treatment. But I think when we were drafting it, we don't think that just because you have pot on you, you're an addict. So we didn't think that that would
If
be.
they want to do treatment instead of, would they be given that option?
Oh, so that I didn't get that from your question, to be given that option.
They're not.
The
currently
option-
But the question was, can I treat them?
I was
Not
just
do I
thinking,
choose to be
like,
treated?
if I was somebody who got caught with marijuana, and I kind of know that, hey, obviously there's a problem. If I'm getting a fine for smoking marijuana, then there must be a problem with it, so.
Your fine is not for smoking, your fine is possession. So you may or may not be smoking, but you have it on you. So you could have it on you, went from your body, you're going home, you smoke it once every few months. So it's not necessarily somebody who's a chronic smoker. And for somebody who's caught smoking pot, again, it doesn't mean that they're necessarily an addict. But currently in our bill, that scheme, we don't have that provision.
Yeah, 'cause
And
I'm
40
thinking like a young 25-year-old who has a minimum wage job, gets caught with a little marijuana, he doesn't have an extra $250. Could he or she have the option of going to a class or training like DUI?
Well, and
Instead of paying a $250 fine, at least he or she could get mentoring, because marijuana may not be the biggest problem in their life. Maybe they just need a little bit of education.
So you could remit the fine if you show up for treatment.
Yeah.
And we've talked a lot about and I just want to be clear, the Cassidy Bill 5708, it's a $100 fine, not a $250 fine. For some people, it doesn't matter because that's a huge enough fine. So to acknowledge that that's the reality. And I think we've tried to figure out what we can do for those people who can't afford to pay the fine, because we don't think that they should be arrested just because they don't have the money. One of the things that we've talked about in pursuing a bill is to lower the fine. So, and definitely if we were to in any way consider lowering the amount, it would have to be a lower fine too. In the ideal scenario, we'd have something more along the lines of the DC model where it's $25. You probably have close to that in the weed that you have on you if you have a small amount. So then that would be more of it's more likely that you'd be able to pay that versus $100 or $250 or $300.
Yeah, I'm gonna butt in here 1 second and say, can we stop thinking about using the criminal justice system to get people into treatment and like just fund treatment? You know what I mean? Like why is this the point that we have to push people into treatment? I mean, that's the point of decriminalization. So I think the question, though, you know, I understand the issues, but, you know, if we had more treatment available, then people who had problematic cannabis use could access that independent of what the penalty was. And that's the problem, is that our driver to treatment is a criminal justice system, which sends everyone to treatment, whether or not you need treatment, and then the delivery of those services is actually rather poor.
Well, and
So,
law enforcement is wildly unsuccessful in reining in marijuana use in our country. I mean, they're catching an extremely small percentage of the consumers. If you look at the statistics, 45% of the entire population, adult population in America, admits to having consumed marijuana at some point in their life, including our current and last 2 presidents. And so, you know, we've got a society that regularly consumes marijuana, and law enforcement catches 2%. 3%, and so we're going to compel all of those people into a treatment program on the assumption that they have a problem. It makes no sense, no sense.
And with the racial disparity, assuming that African Americans are going to have the problem. I mean, because that's the
Sure.
population
That's the
being
population
targeted.
that's getting in trouble.
And so that means that people would be compelled to seek treatment based on their race rather than on their disorder or lack thereof. So I think we need to stop using that as a mechanism.
So one last question, and you each have a minute, good luck. If 5708 passes, or the version that would make that a criminal offense, what do you see as the next steps towards legalization, taxation, regulation?
That's our ultimate goal, and we're very clear about that. So one of the things we're working on is research around the impact of taxation and regulation on health as compared to prescription drugs and alcohol, the economic impact, there was a bunch of other components to it, but I think research is really needed. I think this is like one step in a long-term goal for legalization and taxation and regulation we needed in Illinois. And I think to acknowledge that decrim, while it's good, it's really good for some folks, it's not enough, because we do still see disparities of who ends up being, at the end of the day, you're still going to have who's stopped, who ends up in jail, who is able to pay the ticket, who isn't able to pay the ticket. So I think that's the long-term goal. You know, I was talking to some folks in Springfield about, you know, what after the MPP poll came out, you know, what do you think? And these were people who are kind of more on the opposite side of this issue. And I think for a lot of people, they're looking at what's going to happen with medical marijuana. And the idea being that, you know, for folks who've invested in getting the licenses to have their own medical marijuana facilities, that they want that period of time where they get a monopoly on the market. So the thought is like, which is interesting, the thought is, you know, 5 to 7 years, then that's where we'll be in Illinois. I'm hopeful that it's sooner. I'm hopeful that it's kind of like, you know, once we have marriage equality passed in some states, the public opinion was really high, then all of a sudden every day you state you get marriage equality. I hope it's the same way with decrim. I hope by the next time we're here, we're talking about a legalization bill. I think that's a bit too hopeful, but perhaps in the next 5 to 7 years.
I think it's an inevitable progression that will end up in the way the question implies. I am against really all prohibition of personal vices, not just drug use. I think there's a strong theological argument for that, so I favor that inevitable trend when it comes to drug use. But one thing I like about the report so much is the fact that it does give us such a strong argument for arguing about decrim. I think I've often wondered when I was working on medical marijuana what I would say, and I wasn't asked very often, well, aren't you really just for tax and regulate? And I wanted to be a person of reasonable integrity and not lie about that. So what I would have said had I been asked more often was, there will be a strong, intense public debate about tax and regulation when that comes forward. But right now we're focusing on the incredibly important reasons why medical marijuana is before us. I think we should do the same thing with decriminalization and let the next debate occur when it's going to occur.
So I think that, you know, the top priority is eliminate penalties that can saddle a person for life and eliminate a lot of options that should be available. When it comes to a tax and regulate approach, the question is, when is Illinois going to be ready to stop rewarding criminal behavior? You know, we need to get away from an underground market that thrives and has thrived for decades. Will continue to thrive for decades until we decide as a society that we need a better approach. And then the solution is to shift that market into one in which it's regulated, in which, you know, drug dealers don't card. If you want to protect minors from access to marijuana, it's get it out of the hands of the people who don't mind selling it to minors, right? And I think in 10 years, we're going to look back and think that that is just obvious. But we're really in the middle of this transition. And so Washington and Colorado are finally a location where we can see how this is going to play out. I think Illinois, Texas, other states that we're working in right now are going to see what's going on in those states and say, well, that's a no-brainer. That's the way we can control it.
So Chris, what, just in a national picture, who do you see going next for tax and regulate?
Alaska.
And then?
Then we're going to have a bunch of states in 2016 because we're going to have a lot of voter initiatives.
And what are those states? Just to give us folks here.
Nevada, let's see. I'm sorry, I'm not going to be able to rattle off the list.
It's on their website.
I have a subset of states that I work in very, very extensively. Nevada's, well, and Arizona. Those are the two states of my set that we will surely see a very, very strong effort.
Is Maryland coming along?
Yeah, Maryland is coming along. That could actually happen through the legislature.
Well, I'd like to thank our panelists. I'm sorry that if you didn't have your question answered, come on up now and ask them so you can get it.